Welcome to today's video about warning signs. Your liver is screaming through your skin. Your liver is talking, but you might not be listening. Over 25% of people worldwide have fatty liver disease. Most have no idea. Your liver has been painting urgent warning signs across your skin for months, maybe years. If you're new to our health channel, welcome. Hit that like button, subscribe for life-changing health information, and let us know where you're watching from in the comments. We love connecting worldwide. Today, we're exposing 14 scientifically proven skin symptoms that could indicate fatty liver disease. Some are subtle and dismissed as aging. Others demand immediate medical attention. These skin signs often appear years before you feel sick, giving you a precious window to reverse the damage. All right, here's the countdown of skin signals that reveal your liver is in trouble. Starting with number 1. Jaundice. Jaundice describes skin discoloration from bilirubin accumulation, visible when serum bilirubin surpasses 2 milligrams per deciliter. Unlike acute conditions where yellowing appears suddenly, fatty liver-related jaundice develops gradually. You might first notice a subtle yellow tint in your eye whites, or a slight golden hue to your skin that others might mistake for a healthy glow. The mechanism behind this is disturbing. As fat accumulates in liver cells, it severely impairs the organ's ability to process bilirubin efficiently, causing this yellow compound to build up dangerously in your blood and tissues. What makes jaundice particularly alarming in fatty liver disease is its timing and implications. When jaundice appears in this context, it often indicates progression from simple fat accumulation to serious stages like non-alcoholic steatohepatitis or early cirrhosis, making it an urgent medical emergency demanding immediate intervention. Next, warning sign number 2. Pruritus. Imagine an itch so intense it disrupts your sleep, affects your concentration, and seems to come from deep within your skin, where no amount of scratching provides relief. This is pruritus, a debilitating symptom reported among 80% to 100% of patients with cholestatic liver disease, representing one of the most torturous manifestations of liver dysfunction. Research shows that pathogenesis involves multiple pruritogens, including bile acids, lysophosphatidic acid, endogenous opiates, and progesterone derivatives. These substances build up in your bloodstream when your struggling liver can no longer process them effectively. The pruritus of cholestasis tends to be generalized, affecting large areas simultaneously and leading to violent scratching resulting in excoriations. Unlike skin conditions causing localized itching, this affects your entire body, and conventional antihistamines provide little relief because the mechanism isn't histamine-mediated. Research shows pruritus occurs in 69% of primary biliary cholangitis sufferers, and for 75% of patients, itching was present before diagnosis. Most disturbingly, approximately 65% report nighttime intensification, severely affecting sleep quality and creating a vicious cycle of fatigue. Next, warning sign number 3. Spider angiomas. Spider angiomas are vascular lesions characterized by anomalous dilatation of tiny blood vessels just beneath your skin surface. These lesions contain a central red spot with reddish extensions radiating outward like a spider's web, creating an unmistakable and concerning pattern that experienced physicians immediately recognize. Spider angiomas consist of a central papule measuring 0.5 to 1 millimeter in diameter, corresponding to a dilated arteriole, from which numerous capillaries radiate peripherally. While present in 10 to 15% of healthy individuals, especially children and women using estrogen-containing medications, approximately 33% of patients with cirrhosis develop these lesions. When your liver can no longer effectively metabolize estrogen due to fatty infiltration and cellular damage, elevated hormone levels cause small arterioles in your skin to dilate and become prominently visible. Having more than 3 spider angiomas is likely abnormal and may strongly indicate underlying liver disease. They typically appear in the superior vena cava territory, primarily on face, neck, chest, and upper back areas where estrogen-sensitive blood vessels are most concentrated. Next, warning sign. Number 4. Palmar erythema. Palmar erythema manifests as symmetrical, blanchable, painless redness, primarily affecting the hypothenar eminence, then our eminence, and fingertips. This distinctive pattern occurs in approximately 23% of liver disease cases and affects nearly 2/3 of patients with established cirrhosis, making it one of the most reliable physical signs of hepatic dysfunction. The mechanism involves increased serum estrogen levels, elevated vascular endothelial growth factor, and elevated substance P, which work together to activate nitric oxide synthase pathways. This biochemical cascade leads to nitric oxide production, inducing significant vasodilation in the specialized blood vessels of your palms. Unlike temporary redness from physical activity or environmental factors, liver-related palmar erythema remains constant and may intensify as liver function declines. The bilateral, symmetric nature combined with characteristic blanching response when pressure is applied makes it a distinctive marker physicians recognize immediately as serious liver dysfunction. The redness primarily affects the thenar and hypothenar regions, the fleshy areas at the base of your thumb and little finger. Next, warning sign number 5. Hyperpigmentation. Dark patches appearing on your skin, particularly in body folds like neck, underarms, or groin, represent far more than cosmetic concerns. These areas often indicate concurrent metabolic problems that both result from and contribute to liver damage progression, creating a dangerous downward spiral. When fatty liver disease progresses, it frequently coincides with insulin resistance development, where your body's cells become increasingly less responsive to insulin. This metabolic disruption triggers hormonal changes, including increased melanin-stimulating hormone production, leading to darker skin patches in areas where skin folds create friction and increased cellular turnover. Liver-related hyperpigmentation typically appears in flexural areas, specifically neck, underarms, groin, and sometimes around knuckles or elbows. When severe, this pattern is known as acanthosis nigricans, indicating not just liver dysfunction, but metabolic syndrome presence that often accompanies and significantly worsens fatty liver disease. As insulin resistance worsens and liver function declines, these patches become more pronounced and may spread to additional body areas. Next, warning sign. Number 6. Xanthelasma and xanthomas. Small, yellowish, raised patches appearing around your eyelids or on other skin areas could be xanthelasma and xanthomas. Fatty deposits directly linked to serious lipid abnormalities that frequently accompany liver dysfunction. These lesions represent visible manifestation of your liver's failing ability to maintain normal fat metabolism. These yellowish plaques form when your liver's capacity to metabolize fats becomes severely compromised. In fatty liver disease, your liver's ability to process and regulate cholesterol and other lipids becomes progressively impaired, leading to dramatically abnormal lipid profiles in your bloodstream. These excess fats then deposit in various tissues throughout your body, including skin, creating visible yellowish lesions, serving as external markers of internal metabolic chaos. Xanthelasma specifically refers to fatty deposits around eyelids, while xanthomas can manifest elsewhere on the body. Research consistently shows their appearance often correlates with significantly elevated cholesterol levels, particularly in individuals with non-alcoholic fatty liver disease who have concurrent metabolic syndrome. Studies indicate individuals with xanthelasma have dramatically higher heart disease risk, and when combined with fatty liver disease, cardiovascular risk increases exponentially. Next, warning sign number 7. Xerosis. Xerosis, or severe dry skin progressing to scaling and cracking, represents much more than needing better moisturizer. This condition reflects serious metabolic dysfunction, affecting your skin's fundamental ability to maintain its protective barrier and retain essential moisture. When liver disease impairs fat-soluble vitamin metabolism that's absolutely essential for healthy skin, results can be dramatic and persistent. Your liver plays a crucial role in processing and storing fat-soluble vitamins A, D, E, and K that your skin depends on for normal function. When fatty liver disease significantly impairs these processes, your skin progressively loses moisture retention ability, leading to characteristic dry, scaly appearance that defines xerosis and distinguishes it from ordinary dry skin conditions. Liver-related xerosis is particularly distinctive due to its severity and remarkable resistance to traditional treatments. While normal dry skin typically responds well to moisturizers and standard skincare routines, xerosis associated with liver dysfunction often persists despite aggressive skincare interventions. Research consistently shows xerosis in liver disease often coincides with essential fatty acid deficiencies, creating cascading skin problems extending beyond simple dryness. Next, warning sign number 8. Nail changes. Your fingernails keep detailed records of your liver's health, and the evidence might be more alarming than you realize. Terry's nails represent apparent leukonychia, characterized by ground glass opacification of nearly the entire nail, complete lunula obliteration, and a narrow band of normal pink nail bed remaining only at the distal border. Statistics surrounding Terry's nails are striking. 80% of patients with severe liver disease develop this distinctive abnormality. The condition is caused by significant nail bed vascularity changes, secondary to connective tissue overgrowth beneath the nail plate. Nail bed biopsies reveal telangiectasia's presence in the distal band, providing clear microvascular involvement evidence. Beyond Terry's nails, several other nail changes occur specifically in liver disease. Murica's lines present as paired horizontal white bands that characteristically disappear when pressure is applied, indicating severe hypoalbuminemia occurring when protein synthesis becomes significantly compromised. These lines typically spare the thumbnail and are usually seen with severely low albumin levels. The differential diagnosis includes half-and-half nails, Murica's nails, and true leukonychia, each having distinct characteristics and different underlying causes. Next, warning sign number 9. Hair changes. Hair changes, including progressive scalp, hair thinning, and body hair loss in axillary and pubic regions, occur as direct results of profound hormonal imbalances developing when your liver loses its ability to metabolize crucial sex hormones effectively. These changes reflect hormonal chaos unfolding as fatty liver disease progresses and normal hormone processing becomes severely impaired. The most commonly noticed change is often diffuse scalp hair thinning, occurring gradually as liver dysfunction creates increasingly abnormal hormone balance. When your liver's estrogen processing ability becomes significantly impaired, elevated estrogen levels combined with altered testosterone metabolism create a hormonal environment increasingly hostile to normal hair growth patterns. More dramatically, you might notice substantial body hair loss, particularly in axillary and pubic regions. This pattern reflects complex hormonal changes in liver disease, where altered sex hormone metabolism creates a feminization effect in men and disrupts normal hormonal patterns in women. Unlike temporary hair loss from stress or nutritional deficiencies, liver-related hair changes tend to worsen gradually over time and typically don't respond to conventional treatments. Next, warning sign number 10. Paper money skin. Paper money skin presents as fine, superficial capillaries, creating distinctive thread-like patterns, typically appearing on chest or upper trunk areas. This unusual name comes from resemblance these dilated blood vessels bear to intricate, fine lines and patterns found in paper currency. This distinctive pattern develops when chronic liver dysfunction begins significantly affecting your body's vascular systems. As liver disease progresses over months and years, It creates significant alterations in blood flow patterns and vascular resistance throughout your body. These changes cause superficial capillaries to dilate abnormally and become visible through areas where your skin is relatively thin, particularly on chest and upper trunk regions. Unlike spider angiomas, with distinctive central points and radiating vessels, paper money skin shows more diffuse fine vessel networks without central focus points. The appearance often indicates liver disease has been present for extended periods and has begun affecting your cardiovascular system measurably. Research shows these vascular changes reflect significant alterations in nitric oxide metabolism and other vasoactive substances your liver normally helps regulate. Next, warning sign number 11, petechiae and easy bruising. Petechiae are pinpoint non-blanching spots measuring less than 2 millimeters, caused by thrombocytopenia, platelet dysfunction, or serious coagulation disorders. Your liver serves as the major blood clotting factor production site, synthesizing most proteins playing central roles in maintaining normal hemostasis. So liver disease inevitably creates dangerous bleeding tendencies, manifesting visibly as skin hemorrhages and bruising. The liver synthesizes the vast majority of proteins absolutely essential for maintaining normal blood clotting function, including fibrinogen, prothrombin, and coagulation factors 5, 7, 9, 10, 11, and 13. When fatty liver disease progresses and liver function becomes significantly impaired, these crucial clotting factor production decreases substantially, leading to bleeding tendencies becoming visible as petechiae and unexplained bruising. Petechiae result from hemorrhage areas directly into the dermis and often appear first on legs, arms, or trunk as small red or purple spots. Unlike typical rashes, these spots represent actual bleeding into your skin and indicate your blood's clotting ability has become seriously compromised. Research demonstrates alarming statistics. Studies show overall prevalence of prolonged prothrombin time and abnormal activated partial thromboplastin time test results reaches 68% and 63% respectively in liver disease patients. Next, warning sign number 12, loss of body hair. Gradual underarm and pubic region hair disappearance represents one of the most significant and diagnostically important hormonal changes occurring in advanced liver disease. This pattern occurs because your liver's ability to metabolize and clear sex hormones becomes severely impaired as disease progresses, creating a hormonal environment suppressing androgen-dependent hair growth. This hair loss develops because severely impaired liver function can no longer effectively process estrogen, causing blood hormone levels to rise dramatically while testosterone metabolism becomes increasingly compromised. The result is hormonal change cascades affecting not just hair growth, but also other secondary sexual characteristics, creating what physicians recognize as a feminization process that can be particularly dramatic in men while disrupting normal hormonal balance in women. The mechanism involves complex interactions between failing liver function and normal hormone metabolism pathways. When your liver can no longer effectively process estrogen through normal metabolic channels, estrogen blood levels rise significantly, while testosterone metabolism becomes progressively more impaired. What makes this sign particularly significant from prognostic standpoints is its strong association with advanced liver disease and poor overall prognosis, often occurring with other serious liver failure signs. Next, warning sign number 13, facial redness. Persistent facial flushing resembling rosacea, but unresponsive to typical rosacea treatments, might be your liver sending critical distress signals demanding immediate attention. Research indicates facial redness and rosacea-like changes occur with significantly increased frequency in individuals with non-alcoholic fatty liver disease and non-alcoholic steatohepatitis. The connection between liver dysfunction and facial redness involves multiple complex pathophysiological mechanisms reflecting the liver's failing to maintain normal body chemistry. Impaired liver function leads to altered vasoactive substance metabolism, significant hormonal imbalances, and chronic inflammatory processes directly affecting facial blood vessels and creating persistent redness characterizing this condition. This facial redness typically presents as persistent erythema across cheeks, nose, and sometimes forehead, often accompanied by visible blood vessels and occasionally inflammatory papules or pustules easily mistaken for classic rosacea. However, unlike true rosacea, liver-related facial redness often doesn't respond well to standard treatments and may be accompanied by other systemic liver dysfunction signs. What makes this symptom particularly important is its potential to appear relatively early in fatty liver disease course, sometimes before other obvious symptoms develop. Next, warning sign number 14, facial swelling. When your face begins looking puffy and swollen, particularly around eyes and cheeks, it might represent the final warning sign that your liver has reached critical dysfunction where it can no longer perform its most basic, life-sustaining functions. This swelling, medically termed edema, occurs when your liver becomes so severely damaged it can no longer produce adequate albumin amounts, the essential protein responsible for maintaining proper fluid balance throughout your body. Facial edema development represents failing liver function cascades, reaching critical tipping points. As liver cells become progressively damaged and scarred from fatty infiltration, chronic inflammation, and ongoing cellular death, their ability to synthesize proteins, particularly albumin, becomes severely compromised. With inadequate blood albumin levels, fluid begins leaking from blood vessels into surrounding tissues, causing characteristic puffiness and swelling, often marking advanced liver disease. Facial edema typically begins subtly. With mild eye puffiness, you might initially dismiss as fatigue, poor sleep, or normal aging processes. However, as liver function continues declining progressively, swelling becomes increasingly pronounced and may extend systematically to cheeks, neck, and eventually other body parts, creating fluid retention cascades that can become life-threatening. Next, your skin has been trying to save your life. The truth is undeniable. Your skin has been desperately trying to save your life for months or years, sending increasingly urgent messages about your liver's deteriorating health through every visible change, every strange symptom, every concerning mark appearing on your body. Fatty liver disease affects over 25% of the global population, making it one of the most common health conditions worldwide. Yet the vast majority of affected people have absolutely no idea they have this potentially deadly condition until it has progressed to dangerous, often irreversible stages. This makes the skin signs we've discussed today absolutely critical. They represent your body's sophisticated early warning system. From subtle jaundice yellowing that might be mistaken for healthy glow, to alarming facial swelling indicating advanced liver failure, each sign represents different stages and severity levels of liver dysfunction. Understanding these signs gives you power to recognize when your liver is crying for help, often years before traditional symptoms like abdominal pain or fatigue would appear. The most important and potentially life-saving message you can take from this comprehensive information is that these skin signs are absolutely not just cosmetic concerns or minor annoyances. They are medical emergencies hiding in plain sight, written across your skin in a language that, until today, you may not have known how to read. Don't make the potentially fatal mistake of dismissing these signs as normal aging, stress, or minor skin problems. Don't hope they'll simply disappear on their own with time. Your liver is sending you increasingly desperate signals, and the time to listen and take decisive action is right now, before irreversible damage makes intervention impossible. Remember this crucial fact: fatty liver disease is often completely reversible in its early stages through comprehensive lifestyle modifications, targeted dietary changes, and appropriate medical intervention guided by healthcare professionals. However, once fatty liver disease progresses to cirrhosis, where healthy liver tissue becomes replaced by permanent scar tissue, the damage becomes irreversible and potentially fatal. The research we've presented comes directly from peer-reviewed medical journals, respected medical institutions, and current scientific understanding of how liver disease manifests through visible skin changes. While this information should never replace professional medical advice or consultation, it can empower you with knowledge to recognize when it's absolutely critical to seek that professional advice urgently. Your skin tells your liver's story with remarkable accuracy and detail. Today, you've learned how to read that story, how to interpret the warning signs your body has been sending. The critical, potentially life-saving question now is, what will you do with this knowledge? If this video has been helpful in opening your eyes to these crucial, potentially life-saving warning signs, kindly type helpful in the comments below. Knowing that this information is making a difference truly motivates us to continue producing more essential life-saving content like this. Please like this video to help us reach more people who desperately need this critical information. Share it with anyone who might benefit from learning these warning signs, and subscribe to our channel for more essential health information that could literally save lives. Thank you for taking the time to learn about these critically important health signals. Your liver, and ultimately your life, may depend on recognizing these signs and taking immediate action. Stay healthy, stay informed, and remember, your skin is constantly telling you the truth about what's happening inside your body.